Good morning. Today we're going to be going through Chapter 7, the nursing process in psychiatric mental health nursing. The nursing process itself is a six-step problem-solving approach to patient care to help secure safety and quality care for our patients. In psychiatric mental health nursing, we base our nursing judgment and behavior on the nursing process. The nurse facilitates care that is appropriate, safe, culturally competent, developmentally relevant, high quality. The six steps used in the nursing process, again, are assessment, nursing, diagnosis, outcome planning, implementation, and evaluation. These are a foundation for the standards of practice. The standards of practice help provide a criteria for certification, a legal definition of nursing, and they're also integrated throughout the test plan for the National Council of Nursing on the NCLEX. The nursing process is a problem-solving method that helps encourage clinical care based on systematic decision-making, and it can be used in larger systems to help solve problems within those organizations, facilities, and communities. The Institute of Medicine, IOM, and Quality Safety Educational Network for Nursing faculty have established mandates to prepare future nurses with the knowledge, skills, and attitudes needed to achieve quality and safety as they engage in these six competencies of nursing: patient-centered care, teamwork, collaboration, evidence-based practice, quality improvement, safety, and informatics. The primary source of assessment is the patient. Secondary sources of information include the family, neighbors, friends, police, and other members of the healthcare team. So again, those six steps of the nursing process: assessment, diagnosis, planning, implementation, evaluation. Assessment tools will also be used to evaluate and monitor patient progress. Emphasis should be placed on further evaluation of progress and sharing the information with other members of the healthcare team. The psychiatric mental health nurse collects and synthesizes comprehensive health data pertinent to the healthcare consumer's health or situation. A view of the individual as a complex blend of many parts is consistent with the nurse's holistic approach to care. Nurses who care for people with physical illness ideally maintain a holistic view that involves an awareness of psychological, social, cultural, environmental, functional, and spiritual issues, as well as ethnicity, sexual orientation, and age, whether they be child, teenager, older adult, etc. Remember that sexual orientation refers to your preference of partners. So if you prefer to be with man, woman, transgender, that would be your sexual orientation. Nurses that work in the mental health field need to assess or have access to past and present medical history, a recent physical exam, any physical complaints that the client is experiencing, and document any observable physical conditions or behaviors, such as unsteady gait, abnormal breathing patterns, facial grimacing, or simply changing a position to relieve discomfort. This is important that the client be observed very carefully, as sometimes physical changes, physical issues can also be associated with psychiatric disorders, or someone that has a physical illness could have a psychiatric crisis based on a couple of things going on with the illness that might be a temporary condition. It's important to note that the nursing process is cyclical. Assessment is ongoing and continues throughout the planning, intervention, and evaluation phases. The initial assessment often identifies the client's immediate needs. The psychiatric patient's right to receive treatment and have confidential medical records maintained is legally protected. The fundamental principle under the American Nurses Association Code of Ethics for Nurses on confidentiality is a client's constitutional right to privacy. Your legal duty as a nurse is to maintain confidentiality to protect that patient's right to privacy. HIPAA became effective on April 14, 2003, stating that you may not disclose information obtained without client consent, except for individuals for whom treatment for implementation for whom it is necessary to go ahead and implement that treatment without appropriate written authorization. So that could be someone that, has an emergency medical situation that needs something right now. HIPAA requires that notes used in psychotherapy be kept separate from the patient's health information. Releasing any information to a third party, including the patient's family or employer, about that client's condition without the client's consent is a breach of that confidentiality that subjects you and the facility to tort liability as well as HIPAA violations. When assessing children, be careful that data is gathered from a variety of sources, including the caregiver and the child. Assessment of the adolescent patient can be difficult because of the issues of confidentiality, and sometimes these kids may not want their parents to know everything that's going on with them. There are certain things, we'll talk about it a little bit later, that you have to report with these children. Things like suicidal ideations, substance abuse, so we'll talk about that. Older adults that have special needs that may make interviewing difficult include physical limitations such as being able to hear, being able to follow instructions, those kind of things. So when you're interviewing this older adult, you want to make sure that one, you're facing them and that you're talking slow, steady, in a monotone tone voice, that there's no background noise. When you give them simple instructions, they should be in writing and very simple and to the point. There are many opportunities to misunderstand the client, especially when they come from a different cultural or social background. If the interview is conducted with English and the patient speaks a different language, then we have to consider an interpreter, especially if the patient doesn't speak English. Then an interpreter would have to be used. Also, the person would have to comprehend English. So just speaking it wouldn't be enough. When you're speaking to them, they would also have to comprehend it. Healthcare professionals require an interpreter to understand the patient's history and healthcare needs. Federal law mandates the use of trained professional interpreters in healthcare settings when language is a barrier to communication. A professionally trained translator must be proficient in both English and the patient's spoken language and dialect, and they also have to be familiar with the culture and other things about that patient's background. The assessment interview begins with the mental status exam. We gather objective data, mental or emotional status, and subjective data, the psychosocial assessment. The medical exam, history, and systems review would be completed using a comprehensive assessment. In psychiatric nursing, we have many goals, including establishing rapport, obtaining an understanding of the current problem or chief complaint, reviewing the physical status, and obtaining those baseline vital signs. We assess for risk factors that affect the safety of the patient or others. So we look for things like suicidal or homicidal ideations. Assessment tools may be used to evaluate or monitor the patient's progress. Emphasis, again, should be placed on further evaluation of progress and sharing that information with other members of the team. The nurse would observe the person's physical behavior, both verbal and nonverbal, appearance, speech, thought content, cognitive abilities, and make an observation centering on the presenting problem, the current lifestyle, the strength of the available resources such as the family, friends, education, and work experiences. See box 7.1 in your book. Particularly in the process of data collection, it's important for the nurse to engage in continuing professional curiosity, which delves into the data that might initially seem minimal, but upon exploration, open up more realization and understanding of the client's situation. It's important for you as the nurse to be alert to look for multiple cues in the patient's external and internal environment. See box 7.2 in your book. A mental health nurse assessment would also include engaging that patient and putting them at ease. This is seen as normalizing the process of assessment to demonstrate empathy and to help relax the client so they feel comfortable in discussing what may be a difficult problem. So the mental status exam is also useful in differentiating between a variety of conditions such as neurologic and psychiatric disorders ranging from deliria and dementia to bipolar disorder and schizophrenia. For the acutely disturbed patient, it's typical for the mental health clinician to administer this mental status exam every day. A psychosocial assessment provides additional information from which to develop the plan of care beyond the mental status exam. It also includes obtaining the following information about the patient: assessment of the mental status, assessment of the psychosocial status, identifying mutual goals for treatment, formulating a plan of care that prioritizes the patient's immediate condition and needs, and then documenting that data in a way that we can retrieve it. Most nursing assessments include a physical component, baseline vital signs, patient history, and a current review of body systems, and documentation of those patient allergies. The mind-body connection is important in understanding psychiatric disorders. There are many medical issues that can mimic those psychiatric illnesses. See box 7.4 in your book. When depression is secondary to a known medical condition, it often goes unrecognized and untreated. Psychiatric disorders can result in physical or somatic symptoms such as abdominal pain, headaches, lethargy, insomnia, and intense fatigue. All patients being treated need to have both medical and psychological assessment to ensure correct diagnosis and care. Lab work is important. Disorders such as hypothyroidism or hyperthyroidism may mimic certain psychiatric issues. Hypothyroidism can appear as depression. Hyperthyroidism can appear as the manic phase of bipolar. Simple blood tests can help rule out the difference between a physical and psychiatric issue. Abnormal liver enzyme levels can explain things like irritability, depression, and lethargy. When our liver isn't working properly, ammonia levels can build up in the blood and go to the brain and cause something called hepatic encephalopathy. It causes confusion, disorientation, and the person may appear delirious. People with chronic kidney disease often suffer from the same symptoms when their BUN or electrolyte levels are abnormal. Results of the toxicology screen for the presence of either legal, prescription pain medications, Adderall, or illegal drugs such as designer drugs like ecstasy, bath salts, special K, hallucinogenics such as LSD, ecstasy, or heroin can also provide useful information for us. Fundamental to the assessment of psychiatric disorders is the mental status exam. This is used in psychiatry, and it's equal to the physical exam that we use in regular medicine. The mental status exam is useful in helping us differentiate between a variety of systemic conditions as well as neurological and psychiatric disorders ranging from delirium, dementia, to bipolar disorder and schizophrenia. The patient's psychosocial history is often the subjective part of the assessment. The focus of the history is the patient's perception and recollection of his or her current lifestyle and life in general, how they deal with their family, their friends, education, work experience, what are their coping styles, what's their spiritual or cultural beliefs. Yes, we consider both spirituality and religion when we deal with our psychiatric patients. Studies have shown that being part of a spiritual community is helpful to our clients for coping with illnesses and recovering from things like surgery. Spirituality and religious beliefs have the potential to exert an influence on how people understand meaning and purpose in their life and how they use critical judgment to solve problems in the middle of a crisis, such as the crisis of an illness. Spirituality also refers to how we find meaning, hope, purpose, and a sense of peace in our life, centering on those universal personal questions and needs. Religion is an external system, and that includes beliefs, patterns of worship, and symbols. Belonging to a religious community provides support during difficult times. For many clients, prayer is a source of hope, comfort, and support in healing. A recent study of the baby boomer generation showed that higher levels of spirituality were related to better mental and physical health. They resulted in less anxiety about fear of aging, and they buffered the impact of negative life events when they occurred. Because nurses are increasingly faced with caring for the culturally diverse population, assessment, diagnosis, and care should be planned around unique cultural health care beliefs, values, and practices. Having knowledge of a client's cultural beliefs and healthcare practices can mitigate against stereotyping, stigmatizing, and labeling of those patients. Clients from a culturally diverse background seem to respond better when the nurse incorporates the client's individual needs, values, and social circumstances into their plan of care. Be aware of your own cultural and social beliefs. These can influence your interaction with a person from another background with a different cultural, social, and spiritual or religious belief. Examine how you feel right before you do this interview. We are not always aware of our own personal feelings or how they affect us when we begin an interview. Some anxiety while conducting an interview, especially if you're a student or a new nurse, is normal. Positive work environments can provide a safe place for the nurse and the client to discuss and assess their stressors and receive report. Nurses and other healthcare professionals who have a history of adverse childhood experiences may experience physical, social, emotional, and behavior effects that can hinder or help patient-staff relationships. Being assertive and confident while you build a professional relationship with your client will help you improve your communication skills. Assertiveness is defined as terms of the honest and legitimate expression of your personal opinion, needs, wants, and feelings without denying or violating the rights of others. Poor assertiveness in nurses is related to burnout, less commitment to the work, and less effective utilization of the nursing process. Assertive communication helps you as the nurse to build effective team relationships because when we collaborate with other healthcare professionals, it requires a higher level of assertiveness and cooperation. Poor or ineffective communication is a major reason or cause for medical errors. Your ability to be assertive is key not only to preventing medical errors, but also to reducing your client's risk and improving your nursing care. After the assessment, it's useful to summarize pertinent data with the patient. The summary provides the patient with reassurance that the healthcare provider understands his or her message, and it gives the client an opportunity to clarify any misinformation. The client should be told what will happen next. For example, if the initial screening takes place or initial assessment takes place in the hospital, you should tell the client who they will be seeing next. Validate the assessment. Validation is the act of double-checking or verifying data to confirm that they are accurate and factual. Validating data ensures that assessment information is complete. The objective and subjective data agree. You may obtain additional information that may have been overlooked. Fundamental to the assessment is the mental status exam. Students will self-administer or administer a mental status exam with a trusted partner. The results will be kept private. This will be done in our clinical portion. Were there any surprises in the assessment tool? If you were assessing a client's mental health status, how might you take age, cultural, and spiritual components into consideration. Watch the following YouTube link to see how Merck shows us how to conduct this mental status exam. Generally, the mental status exam aids in collecting and organizing objective data. The nurse observes the person's physical behavior, verbal and nonverbal communications, appearance, speech, thought, content, cognitive ability, as well as observations centering on the presenting problem, current lifestyles, strengths of resources such as family, friends, education, and work experiences. During the mental status exam, we're looking at personal information such as age, gender, marital status, religious preferences, race, ethnicity, employment, living arrangements. How do they appear? How well are they groomed? What's their level of hygiene? Any dilation or constriction of the pupils that could indicate, drug use? Facial expressions. How's their BMI? We're looking at their overall nutritional status. Any body piercings, tattoos? What's the relationship between how they look and their age? Does it match? Is it congruent? Do they look really old for their age? Or do they look good, healthy, young for their age? How's their behavior? Are they engaging in any excessive or reduced body movements? Do they have any funky, odd, eccentric, or peculiar body movements? Any abnormal movements like tardive dyskinesia, the pill rolling, the lip smacking, tremors. What's the level of eye contact? How's their speech? Is it slow, rapid, normal, loud, soft, normal? How do they articulate? Any problems with their speech? Are they slurring their words, stuttering, mumbling? Any cluttering, which is rapid, disorganized, or tongue-tied speech? Then we look at affect and mood. Affect is the way that they present, like as far as when you look at someone's face. So usually if someone's sad, their face will reflect that. If they're crying, you'll see that in their face. If they're laughing, you'll see that happiness in their face. Or if they're angry. So how is that facial expression in comparison to what it should be? Like if I told you someone just died and you were crying, I would expect that. If I said my mom just died and I'm laughing, I wouldn't expect that. How's that mood? Is it sad? Is it labile, meaning all over the place? Or is it euphoric? Or do they have this like highness to them where they're accelerated or above, a little energetic? How's the thought process? Is it organized, disorganized, coherent? Do they have any flight of ideas, any distortion in their thoughts, any delusions, any obsessions, any suicidal thoughts? How's their perceptual disturbances? Do they have any of those? Any hallucinations, illusions? How's their cognition? So are they oriented to time, place, person? What's their level of consciousness? How's their memory? Do they have good memory? Is it intact? What's their knowledge level? And then their attention. Are they able to pay attention? And abstract. Are they able to think abstractly? Do they have insight, logic, judgment? The patient's psychosocial history is often the subjective part of the assessment. Focus of the history is the patient's perceptions and recollections of his or her current lifestyle and life in general. How they deal with their family, their friends, education, what's their work experience, how do they cope, what are their spiritual and cultural beliefs. During the psychosocial assessment, we look at things like previous hospitalizations, educational background, occupational backgrounds. So are they employed? Where? For how long? Do they have any special skills? What are their sexual patterns? Are they sexually active? Do they engage in safe sex, practice birth control? What's their orientation? Again, orientation is your preference of who you like as a partner. Do they have any sexual difficulties? What are their interests and abilities? What does the patient do in his or her spare time? In which sport, hobby, or leisure activity does the patient participate? Does the patient excel in particular activities or hobbies? substance use and abuse. So what medications does the patient take? How often? What sort of herb or over-the-counter drugs does the patient take? Any psychotropic drugs? Does the patient drink? If so, how much? How often? What recreational drugs do they use? And do they identify the use of drugs as an issue? We look at coping abilities, how they cope when they get upset, who they talk to, what helps them relieve stress, and what did they try this time, or what was different about this crisis versus other ones that they've been able to resolve. Spiritual assessment. Does the patient have a spiritual or religious affiliation? What gives this patient strength and hope? And do they have spiritual beliefs that help them during stressful situations? And what are their cultural or religious or spiritual beliefs? Do they have any restrictions for diet or medical interventions? When we look at cultural assessment, we want to know, does a patient need an interpreter? What's the first thing the patient does when they become ill to address the illness? How's the patient been treating this illness? How's the condition, medical or mental, viewed within that patient's culture? Are there any special healthcare practices in the culture that address his or her medical or mental problem? What are the attitudes towards mental illness in their culture? Does the patient have any culture-specific beliefs that may help him or her cope? And does the patient's diet consist of culture-specific foods? If not, how can we address it? A psychosocial assessment provides additional information from which to develop a plan of care beyond the mental status exam. It includes obtaining the following information about the client. What is the client's central or chief complaint in the patient's own words? Do they have a history of violence, suicide, or self-mutilating behavior? Do they have a history of alcohol or substance abuse? What is their family psychiatric history? We also look at personal psychiatric treatment, including medications and complementary therapies, the client's current stressors and coping techniques that they're using, and their quality of activities and daily living. For the psychosocial assessment, we look at their personal background, their social background, including their support system, any weaknesses, strengths, and goals for treatments. We also consider any racial, ethnic, or cultural beliefs and practices, including diet, medication practices, any restrictions, spiritual beliefs, or religious practices. So, like with Jehovah's Witness, we look at the blood components. A lot of them don't want to take blood, but some will take other things that are not actual blood, but could also help them live, like certain components they will take. So we just have to talk to our patients and make sure that whatever we're giving them is something that they want and it's going to help them. Identifying risk factors is one of the key objectives we use when we assess adolescents. To do this, we use a structured interview technique called the HEADS interview. Because adolescents may fear what they say to the nurse will be repeated to their parent, at least part of the interview should be conducted without the parent or caregiver present. Adolescents should be told from the very beginning that their records are private and they should receive an explanation as to how information will be shared among the treatment team. Questions related to sensitive issues such as substance abuse or sexual abuse demand confidentiality. However, threats of suicide or homicide, use of illegal drugs, or use of abuse must be shared with other professionals as well as with the parents. We look at several things under the HEADS psychosocial interview technique. We look at the home environment. How's their relation with the parents and the siblings? We look at education and employment or school performance. We look at activities such as their participation in sports, after-school activities, and their interaction with their peers. We also look at any potential drug, alcohol, or tobacco use. We look at whether the client is sexually active, practices safe sex, uses contraception, or practices alternative sexual lifestyles. We also look at suicidal risks, symptoms of depression or other mental health disorders, and then savagery, which would be violence or abuse in the home environment or in the neighborhood. As a mental health nurse, you analyze the assessment data to determine the diagnosis, problems, and area of focus for care, treatment, including the level of risk. As a nurse, we diagnose using the appropriate nursing interventions and outcomes. We make a clinical judgment about the client's response, needs, mental health problems, level of risk, and potential physical illnesses. An actual or potential problem can be related to a psychiatric disorder, such as self-mutilation, hopelessness. A medical problem or illness, such as ineffective breathing pattern or potential co-occurring physical illness, impaired physical mobility. Nursing diagnoses from NANDA improve interprofessional communication and assist in accountability for care. A nursing diagnosis consists of an unmet need, an etiology or a probable cause, and supporting data as evidenced by statement or clinical manifestations, the signs and symptoms supporting the stated problem. The problem or unmet need describes the state of the patient as at present. Problems that are within the nurse's domain to treat are termed nursing diagnoses. An example is self-mutilation. The etiology includes factors that contribute to or that are related to the development or the maintenance of a nursing diagnosis title. The related factors tell us what needs to be done to affect change and identify what needs to be targeted through our nursing interventions. An example is self-mutilation related to disturbed body image. In other words, the person is harming themselves because of the distorted image they have of their body. Defining characteristics provide us with supporting data. Supporting signs and symptoms are the defining characteristics that make up the patient's objective and measurable signs, plus the more subjective symptoms that reflect the patient's present situation. The defining characteristics can be linked to the diagnosis and the probable cause with the words as evidenced by. Supporting data would validate the diagnosis. Self-mutilation related to disturbed body image might have the following: poor impulse control, self-inflicted cutting, ineffective coping skills, statements like "I'm ugly when I cut myself, I feel better about myself." A completed nursing diagnosis includes the problem, which is the area that needs intervention, the etiology, which is what is responsible for aggravating the problem, and the defining characteristics, which are the objective and subjective data that support the validity of the diagnosis of the problem. Self-mutilation related to disturbed body image as evidenced by self-cutting, impulsivity, and statements that cutting helps relieve painful feelings of inadequacy is how we would write this nursing diagnosis. Risk diagnoses are used when there's a high chance that a future event may occur in a vulnerable client. Risk for diagnoses are made to prevent an unwanted or dangerous future event to help ensure patient safety. For example, an elderly client with a recent hip replacement might warrant a nursing diagnosis of risk for fall-related injury related to post-op condition and unsteady gait. For a suicidal individual, the diagnosis of risk for suicide would be appropriate. For someone who has recently lost a spouse, risk for loneliness and risk for dysfunctional grief are possible nursing diagnoses. Health promotion diagnoses are used when there's a need to enhance a specific health behavior. Health promotion diagnoses are always stated in the form of readiness for enhanced and supported by the data defining characteristics. In cases of health promotion diagnosis, the related to factors are already known. Motivation for improved health status, so they are not listed in the problem statement. An example is readiness for effective coping plus defining characteristics as evidenced by willingness to enhance self-concept and accept limitations and strengths. The psychiatric mental health registered nurse identifies expected outcomes, and the healthcare consumer goals are planned and individualized to the client or the situation. Outcomes provide direction for continuity of care and are culturally appropriate. Outcomes are stated in measurable terms and are achievable through evidence-based interventions and include a time estimate for attainment. Outcomes are patient-centered and geared to each individual and documented as obtainable goals. The psychiatric nurse identifies expected outcomes, and the healthcare consumer goals are planned and individualized to that client. Outcome criteria are the optimal goal outcomes that reflect the maximum level of client health that can realistically be achieved through evidence-based nursing interventions, whereas nursing diagnoses simply identify the nursing problem. Outcome reflects the desired change. Outcomes are variable, measurable, and stated in terms that reflect the client's actual state. NOC provides 330 standardized outcomes. Therefore, outcome criteria are patient-centered, geared to each individual, and documented as an obtainable goal. Goals must be SMART, specific, measurable, attainable, realistic, with a time frame. The psychiatric nurse develops a plan that prescribes strategies and alternatives to assist the client in attaining the expected outcomes. Planning involves determining the desired outcomes. Planning nursing actions to achieve those desired outcomes includes using the following specific principles. The plan should be safe, evidence-based, realistic, and compatible with other therapies. Inpatient and community-based facilities may use standardized tools, such as care plans, flowcharts, or clinical pathways for patients with a specific diagnosis. These standardized tools allow for inclusion of evidence-based practice and newly tested interventions as they become available. Although the tools may be more efficient, they may not be appropriately focused on the client's needs. Whatever the care planning procedures in a specific institution are, the nurse must also consider the following specific principles when planning care. Safety must be considered. Care must be safe for all clients as well as other clients, staff, and family. Care must be appropriate and compatible with other therapies, with the patient's personal goals, spiritual and cultural values, as well as in alignment with the institutional policies. Care must be individualized to the patient or patient-centered. It should be realistic within the patient's capabilities, given the client's age, physical strength, condition, and willingness to change. We must consider the patient's preferences, health practices, coping styles, developmental level, and individual recovery goals. We're not limited to just that. That's just a few of the things we have to take into consideration. We also have to be reflective of the actual available community resources and technology. So the resources can't just be out there, they have to be available, reachable for the client. So we don't want to give them things to do that are not realistic or that they won't be able to get once they get out of the hospital or leave the facility. Plan should be evidence-based. It should integrate current scientific evidence, trends, and research, using all the best evidence interventions and treatments that are available or as they become available. Evidence-based practice means having a conscientious, explicit, and judicious use of current evidence in making decisions about the care of a client's individual needs. Evidence-based practice for nurses is a combination of clinical skills, use of clinically relevant research in the delivery of effective patient-centered care. Therefore, the use of the best available research coupled with patient preferences and sound clinical judgment and skills makes an optimal patient-centered nurse-patient partnership. Keep in mind that any interventions that are chosen to be used need to be acceptable and appropriate to the individual client. NANDA, International Nursing Interventions Classifications, and Nursing Outcomes Classification are comprehensive, research-based, standardized classifications of nursing diagnoses, nursing interventions, and nursing-sensitive patient outcomes. These classifications provide a set of terms to describe nursing judgments, treatments, and nursing-sensitive patient outcomes. They provide standardized clinical reasoning terms, diagnoses, interventions, and outcomes in your organization as a basis for helping you determine effective care. They enable you to use clinical judgment through the use of these standardized definitions for all terms, evidence-based assessment criteria for selecting the appropriate diagnosis, along with the appropriate activities for intervention and indicators for all outcomes. Populate electronic health record assessments with evidence-based criteria that support effective clinical decision-making, outcome measurement, and individualized interventions. So in some of our healthcare electronic charting, we have these care plans that you can automatically populate. Just remember that when you're populating something, or even when you're doing your care plan, like that you're going to be doing for this course, make sure that you remember that a lot of times the interventions or the criteria in there is generalized. So you're going to have to tweak it and make it individualized for that particular client. So if you use something that's pre-populated, make sure you go in, you carefully look at it, and you make sure that you're not just using some standardized plan for everyone. You have to tweak these and make them so that they fit whatever's going on with your client. Remember, that's culturally, religiously, what they'll be able to cope with, what their values are. If they don't have a belief in this particular intervention or goal, it's not going to work for them. So we have to think about it. How are we going to do this? How can we best incorporate this to get the client to be compliant and to help them get better? Remember, in psychiatric nursing, clients aren't always just going to be cooperative. All right, the psychiatric nurse develops a plan that prescribes strategies and alternatives to help the client in the attainment of the expected outcomes. Inpatient and community-based facilities may use standardized tools, such as care plans, flowcharts, clinical pathways for patients with a specific diagnosis. These standardized tools allow for the inclusion of evidence-based practice and newly tested interventions as they become available. Again, care plans want to follow these principles. So safety, being safe for the patient, appropriate, compatible with other therapies and the patient's private goals, spiritual and cultural values, appropriate within the institutional policies, individualized to the patient. So they have to be patient-centered, realistic, within the patient's reach, considering their age, their strength, their condition, their willingness to change, their coping styles. Evidence-based, integrating the most current evidence practice available in trends, science, research, making sure that we're employing this conscientious, explicit, judicious use of the most current evidence. Construct a plan of care for a patient with a mental or emotional health problem. So here we have this scenario. We have Hal. He's a high school science teacher. He's 38 years old, and he has severe depression with suicidal ideation. He's admitted to the psych unit, and he recently experienced a divorce and a job loss. His appetite's poor. He has done little but sleep for the past 2 weeks. He's very withdrawn, not leaving his room, and he tells the nurse manager that he does not want to interact with other patients on the unit. So let's just think about this for a minute. All right. First, we have this gentleman. He's 38 years old. He has severe depression and he has suicidal ideation. All right. So right away, we have to consider safety, right? Suicidal ideation means we need to keep him within our sights at all times. Anything out of our sight with someone with suicidal ideations is too long. Any second, okay? You're not going to come back and check him in 15 minutes because I'll be dead. All right, so this client is admitted. Now, he's experienced 2 major losses, a divorce and a job loss. So for some people, this is like having 2 deaths. Okay, so they're going to go through this like grieving process. His appetite's poor. He has done little but sleep, so he's sleeping a lot, very withdrawn, and he doesn't want to be around others. So think about what sort of nursing diagnoses you could provide for this person, right? Just write them down on a sheet of paper. Does he have an actual or a potential nursing diagnosis? And what's more important? All right, so he's at risk for suicide. What else? Think about this. What would be your interventions? What would be the goals for this patient? Remember, your goals are not about what the nurse wants, okay? Whatever your goal is, it has to be something your patient can do independently at home. Because on the floor, you're developing this plan of care, you're putting it together, all right? You're going to do interventions to help the patient return to their previous level of functioning. You're also going to want them to do something that aligns with those interventions, but something they can do when they go home. Remember that nursing care plan is about continuity. So it's not just continuity with the other nurses in the hospital while the client's admitted. It's continuity with that patient too, so he continues to engage in these goals and engage in progressing once discharged. The psychiatric mental health nurse implements the identified plan. Recent graduates and practitioners new to psychiatric nursing will participate in many of these activities with guidance and support of more experienced nurses or healthcare professionals. The mental health nurse, PMHRN, who has earned a bachelorette degree, practices at the basic level of intervention, whereas the psychiatric mental health advanced practice nurse, prepared at the master's level or above, is prepared to function at the advanced level. The basic level for psychiatric mental health nursing practice is accomplished through the nurse-client partnership and uses the therapeutic intervention skills. The nurse implements the plan using evidence-based interventions wherever possible, utilizing community resources and collaborating with nursing colleagues. Provision of care implies that interventions are age-appropriate, culturally and ethnically sensitive. Nursing's contribution to the interdisciplinary team focuses on establishing trust and giving positive feedback for day-to-day accomplishments in an effort to boost the client's self-esteem and encourage independence. Practice in psychiatric nursing encompasses basic level interventions, coordination of care, health teaching, and health promotion, the MILU therapy, and pharmacological, biological, and integrative therapies. Advanced practice interventions may include psychotherapy, prescriptions, and performing consulting work. So that's if you're the advanced nurse or the advanced practice nurse. The nurse implements the plan using evidence-based interventions wherever possible, utilizing community resources, collaborating with her colleagues. Provision of care implies that interventions are age-appropriate and culturally and ethnically sensitive. Nursing contributes to the interdisciplinary team and focuses on establishing that trust and positive feedback for day-to-day accomplishments in the effort to boost that self-esteem and encourage independence. Prescriptive authority and treatment. The psychiatric nurse has the additional education and the authority to prescribe medication, provide therapies, and referrals for the treatment of mental health conditions. The APRN can also provide group, couples, individual, and family psychotherapy and may consult with the treatment team to provide guidance for care. The full extent of the APRN's ability to practice independently depends on the state and national laws. Which is a responsibility that only the APRN can perform. A. Conducting psychotherapy. B. Administering prescription medications. C. Integrating biological and complementary therapies. Or D. Adapting health instruction to his patient-specific needs. The answer was A. Conducting psychotherapy. The psychiatric advanced practice nurse conducts individual, couples, group, and family psychotherapy using evidence-based psychotherapeutic frameworks and non-patient therapeutic relationships. As a nurse, you will coordinate and implement the plan of care, maximizing quality of life, independence, and optimal recovery. You'll communicate among family and other healthcare workers and advocate respectable care for the client by the interprofessional team. You'll assist with the patient and family to find alternatives to care and document the coordination of the care. The nurse also implements the plan of care using evidence-based interventions whenever possible, using community resources, collaborating with nursing colleagues. Provision of care implies that interventions are age-appropriate and culturally and ethnically sensitive. Nursing's contribution to the interdisciplinary team focuses on establishing trust, providing positive feedback for day-to-day accomplishments in an effort to boost self-esteem and encourage independence. The nurse must be knowledgeable regarding current research findings, intended action, therapeutic dosages, adverse reactions, safe blood levels of medication being administered, and monitoring the client for any untoward effects. The nurse is expected to discuss and provide healthcare teaching regarding medication to the patient and family for any drug action, adverse side effects, dietary restrictions, drug interactions, and to provide time for questions. The nurse assessment of the patient's response to psychobiological interventions is communicated to other members of the healthcare team. The psychiatric nurse should provide structure, maintain a safe, therapeutic, recovery-oriented environment in collaboration with the client, their family, and other healthcare clinicians. Among other things, MILU therapy includes orienting the client to their rights and responsibilities. MILU therapy also includes informing the client in a culturally competent manner about the need for structure, maintenance of a safe environment, and limits set on the unit. The nurse selects activities, both individual and group, that meet the client's physical and mental health needs. The client should always be maintained in the least restrictive environment. The nurse uses the therapeutic relationship and counseling interventions to help the healthcare consumer in their individual recovery journey by improving and regaining their previous coping ability, fostering mental health, and preventing mental disorders and disabilities. Evaluation of client outcomes is often the most neglected part of the nursing process. Evaluation of the client's response to treatment should be systematic, ongoing, and criterion-based. Supporting data are included to clarify the evaluation. Ongoing assessment of data allows for a revision of nursing diagnoses, change to more realistic outcomes, or identification of more appropriate interventions when outcomes are not met. The psychiatric nurse enhances progress towards attainment of expected outcomes. The evaluation of care is a continual process of determining to what extent the outcome criteria have been achieved. The plan of care may be revised on the basis of the evaluation. Documentation could be considered the seventh step in the nursing process. Patient records are legal documents and may be used in the court of law. Besides the evaluation of the stated outcomes, the nurse notes of all healthcare workers should record changes of patient conditions, informed consent for medications and treatment, reactions to medications, documentation of symptoms verbatim when appropriate, concerns of the patient, and any untoward incidents in the healthcare setting. Documentation of patient progress is the responsibility of the entire team. When patients do not follow medication and treatment plans, they are often labeled as non-compliant. Applied to patients, the term non-compliant often has a negative connotation because the compliance traditionally referred to the extent that a patient obediently and faithfully followed the provider's instructions. The patient is non-compliant often translates into he or she is bad or lazy, subjecting the patient to blame and criticism. Crane cautions nurses and doctors not to blame noncompliance on a patient's stubbornness or bad mood. This can leave both the nurse and client frustrated with anger. The term noncompliant is invariably judgmental. A much more useful term would be non-adherent. It now invites us to find out what is going on in the patient's life that is influencing the client's ability or willingness to take the medication. Under the Affordable Care Act, documenting noncompliance no longer protects the physician, nurse, or manager or hospital for a bad outcome that has led to further illness or injury. A finding of noncompliance may void Medicaid or Medicare reimbursements, which lead to financial losses to the institution and damage to the facility's reputation. The patient did not comply does not protect the nurse, physician, or healthcare worker from malpractice and lawsuits, and advises that meticulous records that document the doctor or nurse's rationale for treatment, clear explanations of what he or she wants the patient to do, and whatever the patient actually complied with that advice will help protect the healthcare worker in the event of a lawsuit. Figure 7.1 from the textbook, The Nursing Process in Psychiatric Mental Health Nursing, is shown below. This is an illustration of the nursing process: assessment, diagnosis, outcome identification, planning, implementation, and evaluation. The Nursing Interventions Classification is a comprehensive research-based standardized classification of interventions that nurses perform. It's useful for clinical documentation, communicating care across the setting, integrating data across different systems and settings, effectiveness, research, productivity measurement, competency evaluation, reimbursement, and curricular design. The classification includes interventions that nurses do on behalf of the patients, both independent, collaborative interventions, both direct and indirect. The Nursing Outcome Classification is a comprehensive standardized classification of family, patient, and community outcomes, developed to evaluate the impact of interventions provided by nurses and other healthcare professionals. Standardized outcomes are essential for documentation in the electronic record or for use in the clinical information system, development of nursing knowledge, and education of professional nurses and students. An outcome is defined as a measurable individual, family, or community state, behavior, or perception that is measured along a line of continuum in response to nursing interventions. Incorporating evidence-based care. The plan should integrate current scientific evidence, trends, and research. Using the best evidence, interventions, and treatments as they become available is being stressed in all areas of medical and mental health care. Evidence-based practice essentially means a conscientious, explicit, and judicious use of current best evidence in making decisions about the care of an individual patient. Evidence-based practice for nurses is a combination of clinical skills, the use of clinically relevant research, and the delivery of patient-centered care and patient preferences. Therefore, the use of best available research coupled with patient preferences, sound clinical judgment, and skills makes an optimal patient-centered nurse-patient partnership. Keep in mind that any interventions chosen to be used must be acceptable and appropriate to the client's preferences and needs. Which step in the SOAPy involves an interpretation of two kinds of data in identifying a problem or a nursing diagnosis? A, S, B, A, C, P, or D, I. So A would be subjective, right? B would be assessment. C would be planning. And D would be intervention. So which step in the SOAPy involves interpretation of two kinds of data on identifying a problem or a nursing diagnosis? Okay, the answer was A, assessment. The nurse interprets the subjective and objective and describes either a problem or a nursing diagnosis. Developed in the 1960s for physicians to reduce inefficient documentation, intended to be accompanied by a problem list. Originally SOAP with IE added later. Emphasis is on problem identification, process, and outcome. So for the SOAPy note, S is subjective data or the patient statement. Objective data, O, for the nurse observations. A is assessment. So you interpret the subjective and objective data, and then you either describe a problem that the patient has or a nursing diagnosis. You plan by proposing interventions. You perform those interventions. That would be your response to the actual patient problem, and then you would evaluate. What was the patient outcome after you incorporated those interventions? Did it help either move towards resolution of that problem, or perhaps those interventions actually resolved that problem? The nurse process is a six-step problem-solving approach to patient care, and it can help secure safety and quality care for patients. The primary source of assessment is the patient. Secondary sources of information include the family, neighbors, friends, police, other members of the healthcare team. The assessment interview includes gathering objective data, subjective data. This is objective data is that mental or emotional status. Subjective data is that psychosocial assessment. A number of tools are provided in this textbook for the evaluation of cultural, spiritual, religious, and mental status. The medical examination, history, and systems review provide a complete, comprehensive assessment. An important part of planning patient-centered care is understanding how spiritual or religious beliefs play a part in the client's life and how they deal with stress. Caregivers must have an awareness of the person's cultural background and social attachments and how those issues affect the way the client experiences healing in their culture. Assessment tools and standardized rating scales may be used to help evaluate or monitor patient progress. Emphasis should be placed on further evaluation of progress and sharing that information with other members of the team. Self-assessment is an important part of the assessment process. There are a number of ways that novice interviewers can gain valuable feedback, support, and supervision. Determination of the nursing diagnosis defines the practice of nursing, improves communication between staff members, and assists in accountability for care. A nursing diagnosis consists of an unmet need or problem or progress towards a goal, an etiology or a cause, and supporting data or evidence-based or manifestations. Outcomes are variable, measurable, and stated in terms that reflect a patient's actual state. Behavioral goals support those outcomes. Short and long-term outcomes are measurable, indicate the desired patient behavior, and include a set time for achievement that are short and specific. Planning nursing actions to achieve the stated outcomes should include the use of following specific principles. The plan should be safe, evidence-based whenever possible, realistic, and compatible with other therapies. Practice in psychiatric nursing encompasses basic level interventions, coordination of care, health teaching, and health promotion, the MILU therapy, pharmacological, biological, and integrative therapies. Advanced practice interventions are carried out by a nurse who is educated at the master's level or higher. Nurses certified for advanced practice psychiatric mental health nursing may additionally prepare to practice psychotherapy, prescribe certain medications, and perform consultant work. The evaluation of care is a continual process of determining to what extent the outcome criteria have been achieved. The plan of care may be revised on the basis of the evaluation. Documentation of patient progress through evaluation of outcome criteria is crucial. The patient's record is a legal document and should accurately reflect the patient's condition, medications, treatment test responses, in any towered incidences. Simply documenting patient noncompliance, non-adherence to medical treatment no longer protects the nurse, doctor, or other healthcare professional or institution from lawsuits when further harm to the patient presents itself. Careful documentation of what has been done to help the individual understand the instructions and understand the reasons behind the medical advice and follow up on compliance issues should be included.